Today, I want to talk about some of the things in this 12-week course. And so, as you know, I work with women who have issues with their weight gain, joint pain, low energy, sleep issues, and brain fog. And this course can help, hopefully will help you with all or any of these issues. And I want to break them down because it's complex. And so I want to start with weight gain. And so what causes us to gain weight? And a lot of times people would say very simply, calories in, calories out. So what we eat does play a factor, of course, but there's so many other things, and we can feel really bad about gaining too much weight. I think society puts a judgment on people that are overweight, and that's just not fair, because through my nutrition studies, I found that there are so many more causes to weight gain. So I just want to talk a little bit about them. It can be the number of calories, and it can be an unhealthy diet. And things like processed foods and sugary snacks and fast food, high caloric beverages like soda, all do play a role in it. So there's no doubt about that. But it also can be our lifestyle. Not being able to get any exercise at all. A real quick little tip: if you walk for 2 minutes after you eat, it can really get your metabolism going, and that will help with the belly fat. So just give it a try, even just 2 minutes. It doesn't have to be walking 10 miles every day. Genetics plays a really big role in all of this. You can look at the parents and the grandparents. It's not only lifestyle and how they've learned to eat and how they've learned to live, but genetics plays a huge role in that, hormones and everything. Our metabolism, it's the rate of what our body burns calories. And many times we have a faster metabolism. My dad was lucky. He was very thin and he could eat everything and anything, and he never gained a pound. Now, I did not inherit his metabolism. And I have to be careful about what I eat, but I don't go to extremes. I can have some fun foods and also eat healthy the next day or the next couple of days. And so it's all about balance. Sometimes medical conditions, if you have things like PCOS, which is polycystic ovarian syndrome, those women are unable to get pregnant or have a really hard time becoming pregnant. And many times hormonal balance plays a really big role. You can notice as we get older, our middle and our hips, that's all hormones, a lowering of estrogen and testosterone and progesterone. And then we start to store fat instead of using it up. Medications, many times people that are on steroids or things like hypothyroid, if your hypothyroidism is acting up, and on medication, antidepressants, antipsychotics, those all will attribute to the gain of weight. Many times emotional factors, when we're under stress, if we have a lot of anxiety and depression, we don't eat as healthy. If we're bored, we sometimes eat too much or overeat, and that really affects our weight gain. If we can't sleep, that plays a huge role in our appetite hormones, and poor sleep patterns and insufficient sleep really disrupts the hormones, especially cortisol. We also want to look at our gut microbiomes and see what's going on in there. And age, as we get older, our metabolism tends to slow down. Can't do much about that. And so we become less physically active, and that all contributes to weight. And then there's so many social and environmental factors like cultural norms, family habits, accessibility to healthy foods. As we know, organic and healthy foods are more expensive than the processed foods, so we really want to take a look at that. But I want to make sure that you know it's really important that weight gain is a complex issue. It's influenced by many factors and a combination of those factors. And maintaining a healthy weight involves a balanced diet, regular activities, and overall lifestyle choices. So if you've tried everything, you've tried every diet in the book, Nothing seems to work. You just can't seem to lose weight. There's probably something else going on. And then this course is for you because we are going to really assess. We're going to find out what's going on in there. As a functional nutritionist, I will assess, recommend vitamins and herbs and lifestyle changes and different foods. Vitamins for sure can really help boost the metabolism. And we'll get to the root cause of that weight gain. And then you pick and choose what you want to do or not do. So I thought that would be really helpful. The next topic I want to talk about is what causes joint pain. So again, many factors, and it's also the result of conditions that affect our joint, the tissue that's around our joints and the overall muscular system. And many of them are like arthritis and osteoarthritis, rheumatoid arthritis, gout. Those all cause joint pain, and it involves inflammation of your joints, and it can lead to pain and stiffness and decreased range of motion, which only makes us stiffer, and it only makes us do less activities. Sometimes injury and trauma can really result, like sprains, strains, fractures, dislocations. All of those will add to joint pain. Repetitive strain or overuse, if you work in a factory or if you do something that a lot of people call, they get tennis elbow from continuing to hit the ball, and you get joint pain and it gets inflamed and swollen. And so we look at the repetitive movements. Inflammation is a huge one. It's what causes most of the joint pain in my clients. And it's like tendonitis or bursitis, and it can really affect our joints. And it's really localized pain, but if you have it in more than one joint, it's probably arthritis or some form of an infection or an overactive something going on in there. We really want to find out. Autoimmune diseases like lupus and rheumatoid arthritis, Hashimoto's, under thyroid, over thyroid, all of those things can cause inflammation, and because the immune system attacks our healthy joints, and that's what an autoimmune disease is. And the studies show that 1 in 5 Americans have some form of autoimmune disease. So we really want to take a look at that. Degenerative conditions, like if you have, again, osteoarthritis, if you've worked all your life in a repetitive movement sort of way, we can wear out our joints. Then another one is osteoporosis. As our bones get older, they can fracture, and especially in the back, and that will cause a lot of pain. Hormonal changes is a big one, because such like when you're pregnant or menopause, and a lot of times that will contribute to joint pain and discomfort. Obesity, we put extra weight on our bones and our joints. That definitely can cause inflammation and joint pain. And then there's genetics again too. It plays a big role in, we have to look at how our parents, if they had osteoarthritis and if they had more inflammation based on the foods that they eat, based on their gut health, all of those things. So it's really, again, important to underline the cause of that joint pain in order to find the appropriate treatment or way of life. And if you're really experiencing severe joint pain, I would recommend that you go to a doctor or a healthcare professional and have some blood work drawn and see what's going on in there. But then there's a lot that you can do, and proper diagnosing is important, but then there are lots of things that we can do to help bring down that inflammation through some lifestyle changes. And this 12-week course can definitely help with that. The next topic I want to cover is what causes low energy. So we call it low energy or fatigue. It can have, again, a great deal of underlying causes, and it's important to identify the specific factors contributing to that fatigue. We really, again, want to get to the root cause of what's causing that low energy. And we'll spend, in the 12 weeks, we'll spend a lot of time examining what really causes your low energy. And every person is different, everything's connected, and everything matters. So we really want to look what's going on in there. A big one that causes fatigue, of course, we know is a lack of sleep. And so insufficient and poor quality sleep leads to feelings of fatigue and low energy. And it's essential that the body rests, repairs, and recharges. We need to get at least 8 hours of sleep, good quality sleep a night. And so we will be assessing your sleep in this course, and we will be assessing the foods that you eat, and we'll be assessing your activity level and assessing your stress level. And we'll continue to assess, and only then will I recommend. And then we'll track, and we'll make some changes based on what's going on in there. Many times it's diet. There are high energy foods and low energy foods. And again, every person is different. So we're going to look at what energy foods are good for you and what foods are zapping your energy. So I have you keep a food, mood, and poop journal in the course. So you list the foods. Again, no judgment. This is not like, oh, I shouldn't be eating this or whatever. We're just going to look at what you eat, how it makes you feel, and how it affects your digestion. And then you can make little or big changes depending on what you want to do. Stress and mental health has a huge impact on our energy level, because chronic stress and anxiety and depression and other mental health issues can drain our energy, and we do feel fatigued. I will assess that. But again, if we agree that you're feeling depressed or overly anxious, have other mental health issues, I will definitely give you some resources, people that you can go to, therapists, mental health workers, other people that will definitely work with you and possibly get you on some medication if that's what you need. Other health conditions definitely affect our energy level. You know yourself, if you have a backache, or if you have the flu, or if you have other illnesses, you have low energy. And many times those medical conditions like anemia, thyroid or hypothyroidism, diabetes, chronic pain conditions, heart disease, those all lead to low energy levels. So we really need to assess, again, find out what's going on in there. Lack of physical activity. I know it's hard to get out there and do some activity when you're feeling depressed or down in the dumps, or it's 30 below zero, or it's raining. But it's funny because the more physical activity we do, the better we will feel and the more energy we have. It's kind of feels like an oxymoron, but it really helps. Again, many medications. People have chronic fatigue syndrome, and we really need to get to the root if that's what you have. It's a very complex disorder characterized by severe fatigue, and it's not improved by rest, and it may be worsened by physical or mental activity. So we really, again, need to get to the root. I know what the signs and symptoms are. I've worked with people that have had chronic fatigue syndrome, and you really, again, need to get to a health professional, someone that really understands that. And I have some real good resources for you. You may have a sleep disorder. You might have sleep apnea, insomnia, restless leg syndrome. All of those things disrupt our sleep patterns, and it does lead to fatigue. Like I said, 8 hours of good quality sleep, if we can get it. And as we said earlier, stress really affects people. It's really funny how you wake up in the middle of the night, your little brain is just going a mile a minute of things that you should do or couldn't do. I try to tell myself 3 things. Do I feel safe? Is it something that I can do about it right now? Is it even anything that I have control over? And of course, the answer is, of course, I feel safe. I can't do anything about it at 2 a.m. And I really don't have control over this issue anyway. It does work sometimes, so try it. Hormonal changes too, a fluctuation in our hormones, such as those occurring during menstruation or pregnancy or menopause, can really contribute to low energy levels. When I was going through menopause, I had hot flashes and I had night sweats, and that really keeps you awake. I had to get up and change my jammies sometimes. So it really can affect our sleep. And there are some natural herbs and vitamins that you can take, or creams that you can use, that are not medications that disrupt other things. Dehydration is another big one. Not drinking enough water can lead to dehydration, and that causes fatigue and decreased energy levels. It also makes us think that we're hungry. So many times what I will do is ask myself, am I really hungry? or do I need some more water? And I try to keep one of these. I try to drink 2 of these. They're 32 ounces, I think, and I try to drink 2 of them every day. This is my second one going here, so hopefully I can do that. But dehydration, I know people, we've had some real warm weather, and people that are out on the golf course or whatever say that they don't feel good. They're really tired. They feel nauseous. And that is truly a sign of dehydration. So be really careful with that. Some environmental factors like extreme heat, high altitudes, pollutants, that all affect our energy levels. Chronic infections like mono, any bacterial illnesses, and fatigue that can persist. And as we said, medications too. Over the Memorial Day weekend, I stepped on a nail and it went right through my shoe. And of course, I looked back and I hadn't had a tetanus shot for a while. So I went in and got a tetanus shot, and the doctor felt that because it was such a rusty nail and it had been so long since I had my tetanus shot, that I should go on antibiotics. And they really played havoc with me. I don't do well with antibiotics. So I was had all kinds of issues, and one of them was fatigue. So I finished my 10 days, and then I really worked hard with pre and probiotics and ate kimchi and drank it and ate as much drank kombucha, ate kimchi, and as many sauerkraut things that I could to get that metabolism going again, get my microbiomes going. Allergies. During the summer, we have a lot of pollen, and a lot of people with allergies, asthma, whatever, just cannot get the proper amount of air in their system. And that can really affect us. Certain foods and environmental allergens, mold, all of those things that we may not see can really trigger and lead to fatigue. Caffeine, an overstimulant, so we rely on excessive caffeine to stimulate us, but then it goes up, and what happens? We crash. And it can be some inflammatory processes in the body, like, again, I said autoimmune and other things. But if you, again, are experiencing persistent and severe low energy, it's really important to consult with your healthcare. But there are things that you can do. Sign up for this 12-week course, and I will show you all of the things that you have control over and that you can do to get yourself up and running again. The next piece I want to talk about is what causes sleep issues. So it's, again, a variety of factors, and they affect both the quality and the quantity of our sleep. So here are some common ones. Stress and anxiety, as we said earlier. High levels of stress stop our digestive system. It slows down our metabolism. It slows down everything and really affects our body. So we really need to learn how to fall asleep. I have some great tips and tricks for you. I have a coach friend who is a sleep coach. She's going to be joining me live on some of our discussions, and she'll give you some great tips to help you fall asleep naturally. Poor sleep hygiene, like irregular sleep schedules, excessive screen time before you go to bed, consuming caffeine, large meals, getting close to bedtime. We recommend that you do not eat up to 4 hours before bedtime. Do not have caffeine past 2 p.m. and not to eat sugar before you go to bed, because that will spike and go up and down and up and down. Many times, again, we talked earlier about sleep disorders. It's conditions like insomnia, sleep apnea, restless leg syndrome, sleepwalking, and night tremors. Those all can affect our sleep patterns. Medical conditions, if we have chronic pain, if we have some gastrointestinal issues, respiratory issues, hormonal imbalances, medical conditions, all can lead to sleep disturbances. Many of the medications people are taking affect their sleep in a negative way. And then they take a sleeping pill, and we become dependent on that. Sleeping pills have their place, but we really recommend that you try some natural things first. Ashwagandha, there are lots of herbs and natural things that we can try to help lower that anxiety level. Substance abuse, such as alcohol, nicotine, recreational drugs, that all can disrupt our sleep patterns. Environmental factors, noise, light, temperature, really can affect. So we recommend that you have things as dark as possible. Many people even just use those eye patches to help them sleep. Shift work and jet lag are two big ones. Again, if you're going to be traveling to another country and it's 7-8 hours difference, we have some herbs and vitamins that we recommend that you take before, during, and after to help with that jet lag. Shift work's a tough one because many times people work 7 hours on, 7 hours off, and then they have a different schedule all of the time, and that really can affect our sleep. Age, again, sleep patterns naturally change as we get older. We many times experience changes in sleep duration and structure, and that can lead to sleep problems. Many older adults, we see this in assisted living or nursing facilities, is they are bored and they're sitting around and they sleep in the morning, and then they take a nap in the afternoon, and then they don't sleep well at night. We recommend an occasional nap for maybe 15 minutes to a half an hour max if you really need it, if you didn't sleep well the night before and you do have the brain fog. But we recommend that you get out and do a little exercise, do something to stay awake during the day so that you can sleep better at night. Conditions like delayed sleep pad, we actually call it circadian rhythm disorder, and it's really hard for those folks to sleep when it's light out or the days are longer, and so those need a special diagnosis, and I would refer people out. Many times it's digestive issues, acid reflux or digestive problems cause issues where you have to get up during the night because you have such heartburn or you feel like you're going to vomit, and when you lay down that really affects people and they have to sit up when they sleep. That can really cause disruptions in your sleep. Lifestyle factors, again, physical activity, excessive caffeine or alcohol consumption, irregular meals can really impact your sleep. And then again, there's treatments that you may be going through. Chemotherapy, radiation is really a big one that affects the sleep pattern. And hopefully some of those are temporary, and we can help you get through those naturally with vitamins and herbs. Again, working closely with your doctor based on what medication you are taking. And I do work very closely with doctors that are open to functional nutrition, and we can partner and make sure that we're all doing what's best for you. So if you're experiencing chronic sleep issues, it's important, especially severe ones, to get some healthcare professional to do an assessment. But then you have many choices that you can do yourself, and I can help you with that. Check out this 12-week course, and we cover all of these things that we talked about in here. So hopefully you can sign up. In the course, you get 3 one-hour coaching sessions individually with me via Zoom. We get 4 group coaching sessions, and they're small. I divide them up based on what your main issues are. And then you can weekly email me with questions and issues, and I'm always answering in the course and adding new material, and you will have lifetime access to this course. So check it out. I'm really excited about it. And so those are the 4 issues that I wanted to talk a little bit about. And the other one is foggy brain. And that one too is what really causes foggy brain, or brain fog we call it, is that it really does affect our sleep. It affects how we feel during the day. And most of the time it's hormonal, or it's a lot of other things. But here's my little sheet on it. What causes foggy brain? So foggy brain is really, we call it brain fog. It's a term used to describe a range of cognitive symptoms that can include difficulty concentrating, memory problems, confusion, feeling of mental haziness. And brain fog can be caused by, again, many factors, but it's really important to get to the underlying cause and address that issue effectively. Again, everybody's different, everything's connected, and everything that we do matters. So we really want to look at things. But one of the big things that causes brain fog is sleep issues, poor sleep, insufficient sleep, sleeping disorder. Those all help us not think as clearly as we'd like to. Stress and anxiety is another one. It can impact our cognitive function and lead to difficulty focusing and thinking clearly. Medical conditions such as autoimmune disorders, thyroid imbalances, diabetes, infections, inflammation has a huge effect on how well we can think. We wouldn't realize it, but there is such a connection between our gut and our brain. It's just unbelievable. And there's even a barrier, it's called the gut-brain barrier, where they don't allow some things to affect our brain because it could cause some real severe damage. And other things kind of seep through there if our gut isn't healthy. So we really want to keep an eye on that. Again, certain medications, including antihistamines, sedatives, pain medications, antidepressants, that all affects our cognitive thinking and affects our brain. Diet and nutrition. When we're going to look at in this 12-week course, your energy level foods and your energy zapping foods. Dehydration and fluctuations in blood sugar really has an effect on our function of our brain. That's one for me. I have a sugar addiction and I continue to work on it. But if I do eat a piece of cake or some sugar, because I try not to do anything other than small amounts of dark chocolate at night, right around dinner time, that really affects me and really causes brain fog. It gives me a real high for a while, and then it really causes me to crash. And so I have to be very careful. If I can eat protein and fats and then have a little sugar, that helps. But to just eat sugar by itself, I can't have a donut first thing in the morning because that would really goof up my whole metabolism. It goofs up how well I can think. I don't want to be going out and exercising. So I have to really be careful with that. Hormonal fluctuations really affect our brain. And especially again during menstruation or pregnancy, menopause, that affects and contributes to brain fog. Mental health conditions, bipolar, other mental health conditions, depression, all lead to brain fog because of those medications that people are taking. And there again, if you are dealing with any of that, I will refer you out to a medical therapist, a mental health worker, someone that works specifically with what issues you are dealing with. Chronic inflammation is a huge one. And it's a lot of times based on our diet, and it can be affected by other things that are going on in our life, but we really want to get to the bottom of inflammation, and sugar really causes inflammation. Lack of physical activity, again, if we can just walk a couple minutes every day, get out and stretch, get out in the sunshine when it's shining, and that really sets our circadian rhythm, and it really helps with brain fog and sleep issues. Environmental factors like pollutants, allergens, toxins, many times affect our cognitive functioning. Allergies such as gluten sensitivity really contributes to brain fog. It affects hormones. Gluten, dairy, sugar, and alcohol really affect our hormones. It affects our gut. It affects our sleep. It affects our stress level. And so we really want to look, some people more than others. So we really want to look at all of that. Caffeine and stimulant use. Overusing caffeine or stimulants really leads us to crash, and that causes cognitive difficulties. A brain trauma or injury, past injuries, like getting hit in the head with a soccer ball or having some kind of a concussion. I know that the concussion protocol is getting much stricter. We're really watching that because a lot of people are having issues with brain fog after they've had a concussion, even years later. And again, the circadian rhythm disruptions. So it's our internal clock helping us sleep patterns. So we should look at going to bed at a certain time and getting up at a certain time. There was a period of my life where I was under quite a bit of stress and inflammation, and I was sleeping 10, 12 hours a day, and that just isn't healthy. So I had to set a bedtime and set the alarm because I wasn't working out of my house. And so it's very easy for me to sleep in the morning, but that was not healthy. And so I started setting an alarm, and now I'm back to I can get or 9 hours of really good sleep. I'm very fortunate. But as we get older, our brain function can lead to cognitive changes and mild cognitive impairment. And one thing that I do work with is women and their age-related conditions. So I'm working with women with osteoporosis, pre-diabetes and diabetes, and some cognitive issues such as dementia, early dementia. And we do get people into support groups and on medication early and start changing lifestyles. And so this 12-week course can really help you with that. In there, we're going to have 3 private one-on-one coaching sessions, and we're going to have 4 group coaching sessions, small groups, put you together in small groups with like-minded people, and weekly emails. And even though it's called a 12-week journey, it's an optimal health quest, a 12-week journey, you can spread that out as long as you want. And so I will help you with all of that. So please check it out. I hope to see you soon. Bye.